and dynamics of African region, that we really need to prioritize all these key priorities in order to actually achieve health for all. And so the discussion today would actually center on the problems, the challenges, and also how we can take opportunities from these problems into seeing solutions for actually ensuring that everyone, regardless of their socioeconomic background, gender, actually integrate and benefit from digital health services. So enough talking from me. I will be introducing our panelists and allowing them to give a brief introduction on what they do to us. And the beautiful part of this webinar is our panelists have this wide range of experience, and they're going to be bringing the unique perspective into the conversation that we're having today. So first on my list is Ms. Esther Opone. So please, can you introduce yourself briefly?
Hello everyone. I think I need to turn on my video, right?
Yes, please, if you can.
Okay. Can you? All right. Hi everyone. Okay, so this is me, Esther Opone. I trained as a medical lab scientist. I graduated from University of Ibadan, and currently I practice as a product manager with a health tech company. Basically, we leverage digital health to improve the health outcomes of people by provisioning, a wide range of software to take care of the needs of healthcare facilities, from labs to hospitals to pharmacies, vaccination centers, and so on, pretty much imaging centers and all of that. So I'm very excited to be here today because I know I'm going to be learning from the other panelists as well, and also sharing some of the things I've learned on the field and how we can join hands to make things better. So, and well done, Digital Health Africa, for putting this together. And I'm looking forward to a wonderful session today.
Thank you, Esther. It's a pleasure to have you here as well. And also Dr. Dawit, who is going to be representing the government side for us today.
Thank you. Good afternoon. It's actually midday here in Addis. So nice to meet you. As I said, my name is David. I'm from the Federal Ministry of Health of Ethiopia. I'm working as a senior digital health specialist there. And our department is mainly responsible for the national implementation in the country. And also we are responsible for setting strategic directions on prioritized digital health interventions. We are also setting the governance frameworks, how the various stakeholders are engaging in the implementation of digital solutions. So my role here is have been here for the last 10 years, being involved in various digital health implementation in the development of policies which ensure the proper implementation of digital solutions and data access and sharing policies. So it's in brief about me. Thank you. Did you hear me?
Thank you, Dr. Dawit, for joining. We really do appreciate you coming along. And also the next on my list is Dr. Olabode Ekering.
Yeah, good morning, everyone. Sorry for joining late. My name is Dr. Olabode Ekering. I'm sorry I just joined in. I would really want to know what is expected.
Oh, we're just basically doing introductions, your name, country, and what you do, basically.
Okay, thank you. Thank you. My name is Dr. Olabode Ekering. I'm a medical doctor from Nigeria. I work with the State AIDS and STI Control Program as the state clinical mentor, and I'm also the founder of the Wise Up initiative. Basically my interest overs around HIV prevention, LGBTQ, health education, health disparity, and sexual health. I'm very much interested in I'm very much interested in ensuring inclusive policies and as it relates to people living with HIV and LGBTQ people in Nigeria. That's where I'm working for now. Thank you.
Thank you so much. It's a pleasure to have you and have your insights into the certain groups of people who are usually excluded from digital services. Also, we have Mr. Abubakari as well.
Hello, good morning, everyone. It's a pleasure to be here. My name is Abubakari Yakubu. I work with the Pan-African Health Informatics Association. We are very much interested in digital health because we believe it's the backbone for expanding healthcare to all groups of people. Let me turn on my video. We believe it's the backbone to extending healthcare to all groups of people, and it is a fantastic initiative you have taken. We believe with such collaborations, we can really achieve the common goal of universal health coverage. Helena cuts across the whole of Africa. We have representation in several countries who are member associations that come in as members of Helena. That is the Pan-African body for healthcare in Africa. And so as a promoter of digital health, we
specialist who is majoring in mental health space. I work as a professional trainer with a civil society back in the country that is operating in the prisons with the aim of empowering inmates and officers. I think it's a very timely discussion of digital health with regards to inclusion and diversity, especially so when you're talking about mental health. So at the back of my mind as we get into this discussion and going forth is how can we incorporate digital health in people who are encountering mental health challenges, mental health disorders? How can we also have the same discussion, have it rolled out within the prisons so that also we can be able to empower these people and ensure that they get the healthcare that they need. So looking forward to a very interactive session. Thank you so much.
Thank you so much, Ms. Lucy. And you did raise a really good point in looking at mental health and how we can actually integrate that into digital health and for vulnerable group of people as well. I'm so happy that we have this diverse experiences and we have this visionary experts who actually do have wealth of experiences to share for this conversation. And I'm so sure we're going to be having a rich and robust interactive conversation. So jumping right into the panel session now. My first question would actually go to Dr. Labode, and I'm looking at asking the question, what are actually like the barriers in accessing digital health services that marginalized groups actually face in Africa, particularly looking at our context of unique complexities and dynamics, cost of living and socioeconomic background?
Thank you for the question. And good morning once again. And looking at that question, minority population in Nigeria and every part of the world face a lot of challenge while trying to access digital health. And if we look at it, minority groups generally, because they are minority, because of certain things, probably their sexual orientation, probably their gender identity, they face a lot of discrimination. And if we look at it very much, discrimination could stem from cultural beliefs and practices. Discrimination could stem from probably them living with HIV and a lot of that. And this discrimination in accessing some of these healthcare services could actually be could affect them accessing digital health services, looking at it, because factors of race, ethnicity. So if they are going to face discrimination accessing healthcare services, they could also face discrimination accessing digital health services. based on a lot of our digital health services are probably not cultural competent enough. People who handle these digital services are probably not able to understand these people. And everything still boils down to the fact that most of it's easy to expect that people who access digital health services are general population. They're like every other person, not taking note of their specific needs. And if we also look at it, minority groups, there could be issues around their limited digital literacy. A lot of all of these things stems from the fact that they are discriminated. These are people that keep to themselves. These are people that will not come out. A lot of time you will see that members of minority group or people who live with HIV, for example, they would always want to associate with themselves, especially if their status is known. If their status is known by all because of ostracization, discrimination, and all of that. And they might lack digital literacy. They might lack, because of the lack of this digital literacy, they lack access to digital devices. Also, we'll look at the cost. Digital health, it's expensive, really. Or let's say maybe expensive. And this will make it inaccessible for these people. Majority of those living with HIV, majority of those in minority groups, majority of those that have different gender orientations or sexual orientations to other people face a lot of discrimination, which prevents them from accessing very good jobs. They cannot access good jobs. They cannot afford digital health services because of the financial resources. And if we look at it again and again, in some areas where, generally in Africa, there are some areas generally, this is even outside minority health, this is even outside people living with HIV, this is even outside the LGBTQ people. There are areas in Africa where there's lack of consistent internet supply or internet connectivity, there's no reliable internet. And this will also make it difficult for minority groups to have access to digital health services. I think there's a lot of work that needs to be done in building a cultural, competent health workforce, really, because I think that that is the major challenge. I was having a conversation with someone, and we're talking about how our training in medical school is not cultural competent enough to even handle issues that pertains to minority group. And when you graduate from medical school, you are expected to attend to people of minority groups as your patients. And it boils down to every and healthcare generally is multidisciplinary. And it boils down to every aspect of healthcare. A lot of people in healthcare do not have these trainings. So managing people with managing minority groups could be challenging for them. Managing minority groups because of specific health needs will be challenging. Now I'm bringing it to digital health. Providing these healthcare services, providing digital healthcare services would be challenging to them. So a lot of work needs to be done. A lot of work needs to be done as it relates to inclusion, going to the curriculum in school, including concepts that pertains to minority groups, going to the kind of training healthcare workers even have, including those things. And there's a lot of awareness that needs to be done to destigmatize some of these cultural beliefs people have in the religious setting, outside the religious setting, and so on. Thank you.
Thank you so much, Dr. Labode. I like that you went in deep into all of the challenges that could erupt up. And speaking about accessibility and cost, especially with my maker, and I'm looking at what is Pharmasex doing to bridge the gap of accessibility and inclusion, and also provide equitable access to services for people of diverse needs, and even looking at remote areas as well. How well are our services reaching them?
Okay. Thank you so much. So, I mean, we've had extensive experience as an organization piloting different types of insurance products in Nigeria, Ghana, Tanzania, and Kenya. We started in Kwara with about 11 local government, rural community, rural scheme. And then we had the Lagos program where we focus on Lagos market women and also people who are into computer works. I think what we realize is that technology has a big role to play what we even see is that there's a different pattern. We see more of women visiting the clinic and children than the male participants. But when you introduce technology, you find out that there's more adoption of men and less adoption of women. I think for us, the starting point should be the provider has a very key role to play in the transition. What Dr. Labode also mentioned, the need to reorientate the providers to understand that, the health system is beginning to experience some challenge in terms of workforce, in terms of equitable distribution of services. And there's a need to see how we can, as digital healthcare providers, we can also work with the traditional providers to have this solution in the forefront. But I think the foundation has to be that there must be a data system that allows patients to have data portability. As simple as a medical call center can easily change the dynamics in the rural community in terms of access to health information, as basic as that, because again, most people do have feature phones, although yes, there's still some challenges with infrastructure where government has to play a very big role to address it. But we as Farm Access, we are focusing on trying to see how we can reorganize healthcare in terms of putting the patient first instead of a physician-led process to empowering patients to be able to make decisions about their health. That means having access to information, providing things around remote access, also working with physical clinics, because that's the first point of contact. The providers have a very big role to play. So we are and also focusing on some patient groups that creates the high impact. But again, we also have to also mention that if you look at our demographics, where we have more youthful population, there's also a need to reassess the health needs and what they really need in terms of actionable information. But I think what is key is how can we also put back the agenda on data ownership for the patient, because a lot of information is locked up in health records, but it's not being mined by innovators to see what possibilities are there. So I think key to achieving the digital agenda is more around how do we enable the reuse of data to improve access, to get more insight about different demographics, and to see how we can have tailored solution, including personalized information for them. Thank you.
Thank you so much for that insightful answer. And speaking of tailored solutions and even putting young people into that agenda, my next question will go to Esther on understanding how can we actually involve young people, because a lot of time tokenized participation is what we actually call your youth participation, in terms of people actually not prioritizing young people's needs. So Esther, please tell us how we can actually prioritize young people's needs into these digital health services.
I think Esther is muted. She's muted.
Esther, you're muted.
All right, can you hear me now?
Yes, I can.
Okay, thank you. I was saying that I'm really glad that tokenized participation is one thing that you mentioned, because that was going to be my first point. When it comes to diversity, equality, inclusion, and all of those things, a lot of people just for the sake of eye service, to look good, they would say, oh, we'll get a representative from one of these groups, one person from the minority group, one person from the youth, one person from this, and then they just hear them without listening. So I think the first thing is whoever it is that is trying to drive this change, perhaps from the government end, the innovator end, they need to really come through with that willingness to actually listen. They need to come through with that should I say, hard to actually get the feedback and listen to their problems and actually decide to work on it and then work with them. More so, another thing is also that apart from gathering data, and I mean, a lot of times they say, oh, you're bringing an intervention, a digital health intervention, or a solution or a policy, or you're trying to implement something or a program or all, and then you're getting, feedback or information, or you're consulting young people and all that. If you actually want to get it also more effective, you also need to learn the art or incorporate the art of reporting down. So a lot of times we go to these young people and we ask them questions, we get insight into their perspective, the problems they are facing, And we take that back and we go and work on it, but then there's no reporting down to them at the end of the day. So at the end of the day, sometimes you don't get to see the results of what they have supplied earlier on, and sometimes they end up feeling discouraged and used. So they get information from them, they go out there and implement it, and there's no feedback to them as well. So that kind of thing can make a lot of people not that engaged when you come to them next time, right? And all of that. Secondly is also, or thirdly is also that as a lot of the first two panelists have answered and all that, young people can make good use of internet, can make good use of digital devices and all of those things. However, the more we are able to use these things, the larger the divide also is. You see, there's a lot of things that are hinged on systematic problems, that it goes beyond just the ability to use the internet, or ability to implement or apply digital skills. So for instance, I can go online, access information online, make use of it to access my health services and all. But then there is usually a limitation in the kind of information that these people are searching for, right? As well as the kinds of places they can get this information. Okay, so going back to the kind of information that these people are searching for, a lot of people are not using digital devices to access digital health information. A lot of people are playing games. A lot of people are catching up with their friends. They are connecting and networking. How about we incorporate these digital health interventions or initiatives and all of that into the very places where they spend a lot of their time? So that way we can ride on something that they're already leveraging, right? To then make it more effective, rather than put it in silos and bring it out there. Because in their head, sometimes it can be, oh, this is just one more app I have to use. This is just one more thing I have to do. I'm not interested. Bear in mind that in Nigeria and in Africa generally, health seeking behavior is quite poor, right? So unless a lot of people, particularly young people, have like a very, very urgent need or a very obvious symptom of something or is deteriorating, a lot of people are not actually actively seeking health information and services, right? So again, avoid tokenism, make sure that you're actually listening to these people, not just for eye service, not just to look good on paper to say, oh, we included them and all of that. Actually listen to them, try to understand their question. And then when you get feedback and they report up to you, you engage them and all of that. Also remember to report back to them, right? Make them feel like they are a part of this process, and we can work hand in hand to make this thing work. We are building this thing for you. We are putting in this policy. We are bringing this program for you. And so every step of the way, of course, as much as you can, following data privacy, ethical rules, and all of those things, and expertise as well, engage them in every step of the process and incorporate or integrate the kind of solutions that you want them to access, to make good use of in places where they already are, in channels where they already frequency, and from that, we can begin to see improvements and change. Now, these people have a lot of potential. Like when you're able to capture young people very well, then you can as well use them as influencers for other people. Now, the other places where we are complaining, oh, the older generation, this, that, even within the same place of work, providers, we find that younger professionals are more likely to, work hand in hand with you or to implement or make good use of these things. Among the users, as in the patients, younger people are also more likely to adopt technology or digital health or whatever it is faster and all of that. So you can use them if you are able to capture them well and get them on board, give them a sense of ownership. Then they can actually be an inroad to reach other segments, other ages, other populations, and yes. So those are some of the things that can help in that regard. Thank you.
Thank you, Esther. And we just heard the young people tell us that we really need to stop tokenization and really include them into digital health decision making. And speaking on inclusion, I want to direct my next question to Ms. Lucy and ask what strategies or initiatives can really be put in place to specifically consider gender inclusion and diversity, especially for vulnerable groups. And you mentioned mental health as well. How can we actually integrate all of this into digital health and even mental health services?
Thank you so much for the question. I will anchor my responses on two key parameters that we consider. Number one, health is a basic human right. However, not everyone has the equal accessibility to healthcare. Now, in this background, then, it means for us to be able to target, to address the diversity that comes across by. For instance, is it due to the mental health challenges? Number two, is it due to the fact that there are people who are what we are calling vulnerable groups and the closed population? Number three, is it along the gender lines? Number four, is it along the youth? Is it along the different socio-economic classes? Then it means we need to put on a hat of broad-based thought process. And the broad-based thought process will call upon us increasing digital health literacy, which is broken down or granulated down along what we will call the cultural context. For instance, right now, the youth are so into what we are calling TikTok, ChatGPT. There's a certain age group which is into Facebook, which is into Instagram. Now, when you look at those kind of diversities, then it means if you're to trickle down this literacy so that you can be able to include everyone, so that you can be able to bridge that gap, then it means you need to use this diverse kind of technology platforms which are user-friendly to all age groups. The next one is we need to also develop a content which is locally acceptable and culturally relevant. Why is this so? Locally, because if we just apply or use which has content which has been developed from up down. For instance, World Health Organization has a lot of content, has a very good policy on digital health. Is that applicable at a local level? And this, I'm speaking from the background in Kenya. Local level for me, I'm looking at that person who lives in a certain particular community which does not understand English. Can I break down this into her or his context in terms of translating it into the language they understand? Culturally, when you talk about digital literacy in terms of inclusivity, you cannot discuss it without considering what we call socio-cultural aspects of various cultural groups. For instance, when it comes to women, in some cultures, women don't have a say. And for you to incorporate something into that particular community, you've got to go through the gatekeepers. Who are the gatekeepers? The gatekeepers are what we call the elders or the leaders of the community. And women cannot have a meeting without them sitting through. So if you're going to trickle down this digital literacy and you want to make it accessible to this particular community along the line of gender, if you don't take that route, then it means we will not be able to gain traction. The next one, what we can do is encourage the establishment of cyber clubs. I think for most of the African countries, we have a challenge of what we call internet connectivity. There are areas where internet connectivity is very on point. There are other areas where it is not on point. So if you can be able to have what we call cyber clubs, you would bring on board people who are not in zones where there is internet connectivity, people who might be challenged in the accessing of the internet connectivity. For instance, in Kenya, we have what we call mobile data. Mobile data means I have to spend a few Kenya shillings to buy data on my phone. So if I am economically challenged, does it mean then I cannot be able to access data, which I can be able to access some digital literacy material which has been uploaded for me? I believe a cyber club would go a long way in addressing this challenge. Now, when it comes to mental health, we need to bear in mind that in different seasons in our lives, we go through different upheavals of mental health challenges. So in such circumstances where you're dealing with people who are mentally challenged or who have neurological disorders, can we also come up with content which is user-friendly for them, cut across for them and tailor-made for them? So those are my few remarks on how we can address the issue of inclusivity, across the various diverse contexts. Thank you so much.
Thank you for those answers. And you're honestly 100% right. One thing I've noticed is the unique complexities in Africa sometimes really needs to be considered in creating digital health solutions. You've talked about internet connectivity, engaging gatekeepers, and even looking at context and policy. And speaking of policies and regulatory framework, my next question will be directed to Dr. Dawit, with the government among us. And my question is, what are the policies or regulatory framework that have been implemented to foster gender diversity inclusion in digital health intervention?
Thank you. So in terms of the policy and regulatory frameworks by the Ethiopian government, actually, it has been long for the Ethiopian government to recognize the transformational power of digital health in terms of service delivery, in terms of accessibility, and the likes. So, for instance, it has been almost 20 years since we have implemented the national HMIS, which is a national health management information system, which can collect data from every angle of the country. So with this information system, the government can direct policy frameworks. It can analyze data coming from this information system to address the health equity, the health accessibility, and the likes. So in terms of policy and regulatory frameworks that has been implemented by the government, I can start from the national level. For instance, the government as a national level, it has launched the Digital Ethiopia 2025. This is a national digital initiative. It talks about digital transformation of the sector. So in that document, there are prioritized digital projects that has to be implemented both in the near term and in the long term. So among the prioritized projects that directly address to foster gender equity, diversity, and inclusion are, for instance, talks about employing human-centered design, so that with that we can include the specific needs of the diverse communities in the country. So it promotes designing digital solutions that can accommodate the needs of the diverse communities in the country. It also talks about digital literacy. So one of the challenges we have in the country to be more usable digital solution is digital literacy. So the national Digital Ethiopia document talks about capacity building in terms of digital literacy, so that people can consume any kind of digital solution or any information provided through digital interventions. So this is one of the prioritized projects. And also it talks about facilitating investment in digital health. So as you know, digital health investment is a very resource-intensive investment. It cannot be done solely by the government only. So private sector has to come on board, and the various stakeholders has to be there. So it talks about promoting investment in IT sector, so that we can make more accessible digital interventions. So this is one of the policy framework implemented by the government. And as part of this process, also the government has promoted a national science museum, which promotes various digital interventions for the community. As you know, this kind of initiative promotes a digital initiative among the community, among policymakers. For instance, just next week we are launching a digital health exhibition, which will be stay for a month. So one of the objectives of this exhibition is to promote digital health among the community, also among the policymakers, so that at the end of the day, policymakers can be aware of the transformational power of digital health. And also on the community side, people can know how digital health can be more effective in making health service more accessible to the remote parts of the country. How can we make health service more cost effective, so that people which are in low income can be more participatory in their health service access. And also, as part of the government policy, we have promoting more women to come on board on digital policy leadership. So, for instance, the Ethiopian Telecom is led by a woman, and also we have a ministry which says National Science, Ministry of Innovation and Technology. So the vice minister is a woman. So bringing more women on leadership position, as you know, has a transformational power in incorporation various views on how to make digital solution more accessible, more reachable to the diverse community. So this is also at the national, it's one of the policy frameworks. And also the government has created a national job creation commission. This job creation commission is promoting entrepreneurship in digital health. So as I said previously, digital health innovation has to be more inclusive of the various stakeholders. So the job creation commission is now promoting entrepreneurship so that digital solutions can be more affordable. As you know, affordability is one of the challenges to make digital solutions by the needy or the people at the remote parts of the country, people which has economically low income. So by promoting digital entrepreneurship, we can make a digital solution more accessible. So these are at a national level. So coming to at the health sector level, the Ethiopian Ministry of Health is also devising various frameworks. Among these frameworks, just to mention the few, we have digital health strategy, which starts from 2020 up to 2029. So this digital health strategy promotes inclusiveness, diversity among all the population, so that digital health interventions we are promoting as a health sector to be more usable, more accessible. So one of the framework we have as a health sector level is the digital health strategy. We have also the information revolution roadmap. It talks about cultural transformation in data use, so that people can use health data for their day-to-day health management. So this is one of the policy document. We have also a digital health blueprint document as a ministerial level. So it talks about prioritized digital initiatives in the country to be implemented for the coming 10 years. So among the prioritized initiatives, promoting remote healthcare delivery so that we can access the remote parts of the country with digital health. So it talks about how can we mobilize the resources, how can we implement digital solutions at the health post level. So these are the policy frameworks both at the national level and by the health sector, which promotes gender, which talks about inclusiveness, which also about accessibility. These are some of the policy frameworks we have at the Ethiopian side. Thank you. Over to you. Hello. Hello. Hello.
We can hear you, Dr. Dawit. Thank you so much for your contribution. I think Taufikat might be having a bit of internet issue. So thank you so much for the insight from the Ethiopian government side. Now we'll be taking some responses from Yakubu, who is representing Helena here. So what advocacy efforts can nonprofits undertake to influence policy and ensure that governments and other stakeholders prioritize gender, diversity and inclusion in their national digital health strategies and initiatives, especially coming from the Helena perspectives? Probably share your experience and some of the work that Helena is currently doing about this. Thank you.
Okay, thank you very much. So far, so good. I must commend all the panelists. We are doing a great job and the information is very insightful. I'm personally learning a lot, and the organizers, kudos for the work you are doing. From a Helena perspective, like I started, first and foremost, we established that Helena has the vision of driving digital health through informatics research, education, and strong advocacy through our national membership. Now, I must state that for us to grow, we must first look at a strong multi-stakeholder collaboration. Oftentimes, when we begin to discuss health, we narrow it to only the health sector. Currently, Helena has a program where we are trying to organize some convergence workshops. And what we are saying is that the issue of health, like we have all known the common saying that the health of a nation is the wealth of the nation. The issue of health goes beyond the health ministry. The issue of health involves every other ministry. It involves every other stakeholder. So from a Helena perspective, I think our first posturing is that we should look at a strong multi-stakeholder collaboration. At the national level, if you talk about health, it is interesting to know that it will be very important to want to look at what is the agric ministry doing, because the health of a people thrives on their food. Now, if you zero into digital, then you are looking at the interesting side of what is the communication ministry, what is the IT systems doing. We think that a strong multi-stakeholder collaboration is very important for us as not-for-profit organizations. We need to drive that. We need to bring all stakeholders on board. And so stakeholder identification, stakeholder management is cardinal to driving home the agenda for digital health. The second thing we should be looking at strongly, which Helena has again been doing, is the issue of research and evidence-based solution. Currently, Helena is rolling out a project where we are looking at engaging graduate researchers to research into digital public goods. And Helena is supporting them with funding through GIZ. And what we are saying is that, yes, there are so many public goods out there. You have to use it. It's free of charge. But what is the value of these goods to Africa? What can Africa do with it? So we know that in Nigeria, for instance, you have the open IMS. In other countries, we have insurance policies that are thriving on some of the GIZ projects. What we think is that research must drive it. It must be evidence-based. Is this working for Africa? And let me make a point that one of the key things we keep looking at is from the word go, when we set to roll out the digital intervention, do we come clear with outcomes? What are the expected outcomes? At the end of the day, what evidence do we have that this outcome is suitable for Africa or not? So at Helena, we believe our decisions and our implementation, digital activity should be driven by empirical findings, research that is supporting decision-making, so that we can convince ourselves that this is African, this is for Africa, and this is suitable to us. That is the second critical point. The third point, I'm glad Dr. Dawit is here. Dr. Dawit, hi. We were at Lilongwe together. The third point has to be policy analysis and recommendation. Of course, if you assess the current strategy for AU, they have a digital strategy. But can we also have a digital health strategy for Africa? What is the policy direction? What are we doing? Again, Helena is currently doing a very vibrant job where we are trying to look at health data governance. And so we are trying to organize workshops. We are trying to organize side events in key regional activities. I know there is one that is coming up in Rwanda, and Helena is supposed to organize a side event. But we are looking at, can we also analyze the policies? Where does digital health place in the broad policy frameworks of Africa? We are looking at after Africa Continental Free Trade. It has been established. in this broader perspective, where do we place digital health? So as not-for-profit organization, we think that we should be jointly also looking at the policies that are being promulgated. How do they set digital health in it? We want Africa to prosper. We want Africa to be a global force to reckon with. We all admit that health is critical. And if we see digital health as the panacea to ameliorating the health issues of Africa, then we must also ensure that it is at the nucleus of a lot of the policies that are promulgated. That is the third point. My fourth point has to do with, we also need to build regional integration. And when I say regional integration, we were in East Africa recently, and if you look at East Africa, for instance, I think one of the panelists mentioned this, that cultural inclusivity is critical. If you look at East Africa, for instance, because they all speak a common language, the Swahili, right? The East and the Southern Africa, it appears that they have a good integration of digital health solutions. If you come to West Africa, commonly Ghana and Nigeria who speak English, we don't even have digital health systems that integrate. We don't have digital health system, just Ghana and Nigeria here, we don't have. Not to talk of Ghana and Burkina Faso, Ghana and Cote d'Ivoire. We must look at, in West Africa, how can we bring together a common, the economists have talked about the ECHO. We don't hear anything about a common platform for digital health. How can we create a common platform for digital health in West Africa? How can we integrate digital health, East Africa, West Africa, South Africa, North Africa? How do we pull that together? I think the issue of integration becomes very critical. To wrap up my points, we must also look at the bottom-up approach. That is grassroots mobilization. We did some work where we are looking at how do we get, I think one of the panelists equally mentioned that, how do we get people to really utilize digital health? The individual factor is the key driver. Let's get the personal health to be critical in digital health. Just like someone can use his mobile phone, whether educated or uneducated, to send and receive money. For us as not-for-profit organization, we should be looking at how can we equally get that person to use that same phone that he can use to send and receive money to also enhance his or her healthcare. The individual factor, it's so critical. Thank you very much. Over,
Thank you so
panel.
much, Dr. That was very, very insightful. And I think I love the aspect that you raised about the digital strategies. For Nigerian, for instance, we do have a national digital strategy, but doesn't explicitly state gender and inclusion in its framework. And I think this is something every country in Africa can look at from the policy angle on how we can actually effectively integrate gender diversity inclusion into our national digital policies or even framework. And I think we've had a splendid one round session now, learning about the problems in digital health and even learning about some of the solution. But now we'll be going right into the solution-driven conversation. Laura Leeson used to tell me that you get 2 points for talking about the problem, but 8 points for talking about the solution. So since we're solution-driven, now is the time to really talk about the solution. And speaking of solution, my question will be directed to Dr. Dawitt, and I'm going to be asking, what can we really do from government side to nonprofit side to civil society organization and even to healthcare providers to really bring a synergized effort to also improve on integrating gender diversity and inclusion into our digital strategy? How can we work together to effectively achieve the goal?
Thank you. So collaboration with civil societies and non-profit organization is very vital to accommodate digitalize the various needs of the or to make it gender responsive. So one of the things that can be done from the government side is that it can get insight from civil society about specific needs and specific issues among the society. As you know, civil societies have the privilege to work with the last mile or the at the front line, so they know the specific needs of the community, especially at the remote parts of the society. So by getting insight about the specific needs and issues about gender sensitive issues, the government can design digital solutions that can accommodate or that can address the issues or that can make gender responsive. And also, as part of this process, it can work collaboratively with donors and implementing partners, so that when they design digital solutions, when they implement digital solutions, they have to take into consideration to make it more gender responsive, to make it more inclusive. As you know, if I take the Ethiopian case, our digital ecosystem is mainly run both by the government and partners. We have donors which have a huge role in implementation of digital solutions, in the design of digital solutions. So while working with these donors and partners, the government can influence them to make more inclusive digital solutions, to be more gender responsive digital solutions. So that's one thing. And the other thing is that the government can do is that it can promote gender diversity in their workforce. As you know, the more women we have in their workforce, they can have various viewpoints about women, about the health issues they have. So when they design digital solutions, they can have the inputs from directly from their workforce. So that's one thing. And the other is creating engagement platforms with diverse communities. So as part of this process, as you know, there is a principle called co-design or human-centered design. So, so civil societies and non-governmental organizations can bring that platform, so that when we design solutions, when we develop solution, we can incorporate their needs. We can make sure that their specific needs are incorporated with our digital solutions, so they can create such kind of platforms. And the other thing they can do is on education and awareness creation. One of the challenges we have is that even though we design very nice digital solutions, even though we implement a very cost-effective digital interventions, unless we have the awareness, the literacy, they cannot consume that one. So civil societies, non-governmental organizations, they have the privilege to bring on board communities so that they can be more aware about their health. They can be more digitally literate. So this can be done by working in collaboration with civil societies and non-governmental organizations. The other thing is training programs. They can prepare training program, workshops that can foster about gender sensitive issues that can be incorporated at the end of the day when we design digital solutions that can be implemented at the most parts of the country. So in my view, these are the very few ones. I didn't go through all the things. So these are the things that government can collaborate with civil societies and non-governmental organizations to address gender sensitive issues. Thank you.
Thank you, Dr. Dawids. That was really profound. And honestly, I think if we can actually get it right from all of the conception stage, would actually be able to really, really integrate gender and diversity into our digital intervention. And taking a cue from promoting digital literacy that you mentioned, my next question would be directed to Dr. Labode, and really wanting to know how can we really promote digital literacy among marginalized groups to actually let them hone up to the information, get informed, and also get empowered to actually use these services that we make for them.
All right, thank you. So promoting digital health literacy, there are quite a lot of things that needs to be done. And I understand the fact that a lot of digital health platforms currently promote confidentiality and privacy, really. And which is quite commendable compared to when digital health platforms started as it is. But then we'll notice that a lot of them do not, in a way, we do not have a kind of inclusive language. Inclusive language, I'm not talking in terms of English or Swahili. I'm talking in terms of the kind of language and the content. You know, we need to, there's a need to bring in languages that respect and recognize the diversity of different people. And this is like using gender neutral terms, not avoiding the assumptions that everyone is straight or everyone is this or that. We should avoid the assumption of people's sexual orientation or gender identity and make sure that every information we give is very clear. Like the people of the LGBTQ community, their pronouns are different. So languages, there's a way content should be driven towards gender neutral terms, gender neutral languages, and all of that. Also, I think it's also very important. It's also very important that while all of this is being done, the kind of content too, they are culturally sensitive. We understand that when we deliver sexual reproductive health content, it's very important that we pay attention to issues around gender diversity. Still boils down to the language. It's important we pay attention to issues around gender diversity, and we should also ensure that while we are also trying to bring in some of this content, we understand that we also have the general public in mind. Also, in promoting health literacy, there is a need for training healthcare providers to be culturally sensitive. I think I said that earlier. A lot of digital platforms can offer modules and trainings for healthcare providers to actually enhance their knowledge on gender sensitive issues, because a lot of healthcare providers do not have basic trainings on this, looking at where they're coming from academics wise or professional wise. Another thing I think we could do to promote digital literacy is create a platform for feedback on these health platforms. If there could be a kind of feedback mechanism where digital solutions to create a kind of feedback mechanism where we can incorporate, the users can report any instance of discrimination and maltreatment from healthcare providers based on their healthcare experience. You know, there should be a way to report that. And I think this feedback, there's a way it can help us drive improvement, identify areas we can improve, and it will also make healthcare providers accountable for their actions and accountable to the digital health platform, and also accountable to the people receiving healthcare. Also, I feel that while we take data for research, it should go beyond research that will just be published in journals. We should begin to look at how we can take research to actions. There are a lot of papers you read and you find very interesting ideas, very interesting proposed solutions, very interesting findings. But you look at it in reality, it's like all of those things end in the papers, all of those things end in the big journals, and we do not have them we do not have the implementation. So there's a lot of work that needs to be done as it relates to implementation of research finding. As much as we collect a lot of data, there's a lot of work that needs to be done in terms of ensuring that these research has helped us to identify gaps. So what are we doing with the gaps identified? And these findings too, we also help us advocate for policy change. Like we understand that some of the policies, a lot of policies are not gender inclusive enough. So these researches that are being done, we also help us advocate for policy change, for interventions that would address stigma. And I also think Esther mentioned something earlier about gamification of digital solutions. And I think that would go a really long way, because people, when you are trying to provide solutions, it's important that the kind of solutions being provided relates to what people are very much interested in. So solutions can be gamified. We could bring in a lot of the design of solutions should be inclusive. Basically, design of solutions should be inclusive, and we should pay attention to the fact that persons are of diverse backgrounds. And this would not. We should also pay attention. Data platforms should also pay attention to promoting education and awareness, and that would dispel some of these some of the wrong information people have about people of diverse groups. Digital health platform will help to promote this, and this will also help to improve data literacy. It's important that there are a lot of misconceptions about people of different sexual orientation. There are a lot of misinformation about them and all of them. And I think it's something we need to address. And lastly, I think that there's a need for community engagement. Dr. Dawit mentioned it earlier. We cannot take away the place of community engagement, engaging communities of these persons. You cannot be providing solutions for people living with HIV and not involve communities of people living with HIV. We should not work with assumptions. You cannot want to provide solutions, data solutions for men who have sex with men, and you want to provide solutions for transgender people, and you will not include them. And you will see that, for example, the transgender people, the LGBT individual may require gender affirming healthcare services, and you are trying to create solutions for them, and you are not incorporating a level of gender affirming healthcare services to them. You know, people living with HIV, for example, require a level of specialized treatment. You wouldn't manage them the same way you manage people who come to the hospitals, and you are not involving them in driving solutions that pertains to them. I think these are things we need to pay attention to, and that these things will help to drive health literacy. Thank you.
Thank you so much for that. And there's a lot to unpack from everything you mentioned, looking at community engagement, digital literacy. All of these are really critical aspects to look into for digital health, integrating GEDI into our digital health services. And that I would like to say that the panelists have shared a lot of insights, and please, we need you to live tweet, especially for participants. So you can live tweet and tag us on Twitter at Digital Health Africa, and also use our hashtag GEDI webinar and Digital Health Solutions as well. So over to Mr. Emeka. I know that Dr. Labode mentioned a little bit on health data privacy, and I want to ask, what are the strategic initiatives that Pharmacex has actually put in place to ensure data gaps and biases are actually addressed in digital health intervention for marginalized group, and ensure that they're not further disadvantaged even in the algorithm or data-driven decision-making Pharmacex make? Mr. Emeka, are you still on the call?
Yes, thank you so much. Sorry, I was on mute. I did mention that one of our agenda is to empower patients to have ownership of their data, which is very central to patient-centered care, which is very key, and that makes it more inclusive when patients are empowered to own their data. I think it's nice to have regulation around data privacy, governance, who is the data controller, what are the responsibilities of the data controller, as well as the data processor according to GDPR, and the need for organizations to also comply with the regular audits, which is quite key. But I think what is paramount now is about how can we use this personalized data for public good, for the good of the patients? How can we create more benefit for them? How can we create more better outcome for them? Because now in a challenge whereby a patient who has to move from one facility to another facility has to probably do the same lab tests that he did in the other facility, so again, it's a bit fragmented in terms of health data. It makes diagnosis quite expensive for the patient as well as for the doctor. It makes it very difficult to really understand how to solve the problem of the patient. Again, around opportunity for people who are trying to come up with innovation around drugs, for example, trying to develop an algorithm to help to improve a certain disease group. So I do believe, yes, we do have a data protection, but again, how can we push it back to the owner? Because actually the real owner is the patient. How can we convert that data that lies in different silos, aggregate them together, put back that responsibility on the patient. The patient now has to give consent to different players who need this information for specific needs. For example, if you have, if someone who is working on remote monitoring, they can get access from some certain group of patients so that they can also obtain their service. If there's someone that's doing a research on a groundbreaking drug, they can also get access. At the end of the day, the patient has an option to also participate in the trial. So I think the key thing is, how do we empower patients in terms of we use, despite the fact there are data policies, the data policy shouldn't be restrictive, but rather for the benefit of the society, for the benefit of the patient. That's very key for us as Farm Access, not just only thinking about bridges, but again, how do we put back the ownership of data from health facilities back to the patient, stay in line with the framework of government, and also making sure that at the end of the day, the benefactor is the patient, not the big tech companies. Thank you.
Thank you so much. And really, it's a patient-owned kind of care that we should be prioritizing, putting people first, and putting people's interest first in all of the digital solutions that we try and incorporate. And speaking about putting people's first, Esther, this question would be directed to you. So what other type of initiatives do you really think we can incorporate digital health intervention, particularly looking at the key priorities we're looking at today, the gender diversity and inclusion? What other role do you think young people can really do play in being a part of this discussion and a huge part of it as well?
All right, thank you very much. So I'm going to start with what you asked, your last statement, which is like the discussion. And I think that the more we have conversations like this, and the more we involve young people in conversations like this, then we can begin to, find ways in which we can, define the exact problems we have, fine tune them, and also work around solutions together. So when we come around in communities like this and we have, this kind of tangible conversations, we have our points of disagreement, we bring things from our own perspectives as youth. And I mean not just conversation as regards just the youth, within these youth spaces alone, because sometimes in a bid to include more people or, foster inclusion generally, let me just use that thing, we tend to go towards extremes. So we tend to sometimes adopt the vibe of, sorry, I'm using the word vibe, the kind of disposition in which, only the young people get to talk, only the young people get to, have their say and all of those things. But when we come, the same way we are talking about intersectoral collaborations, we're also talking about intergenerational collaboration. So when we foster conversations like these, young professionals in a place of work with, the key stakeholders, the older generations, and we begin to see areas in which we can all work together and we can make things more effective, make everybody's voices heard. We leverage the wisdom and the expertise and the years of experience of the older generation, and then we join into the energy and the fresh perspectives of the youth and the field experiences they've had as well. And so we are able to have more effectiveness when we all join our hands and work together, right? So that's definitely one thing, the conversation aspect, and encouraging intergenerational dialogue like we are doing today. Another thing we can also do is also to incentivize engagement and involvement. There's a lot of hackathons going around, there's a lot of health hackathons and all of those things. We need more of those, right? Of course. But more than that, but a lot of them seem to be targeted at people who already, how do I put it? People who already have the advantage or the privilege. So they're already in those areas, they're already in those environments, such as maybe college, universities, and it is good, it is very beautiful and all. But how about we encourage maybe competitions and hackathons and featureathons and ideathons around digital health solutions, and also, of course, with the lens of gender diversity and inclusion, they're also, ensuring that maybe at least one or two team members are also from people in underserved communities, are also being represented. You understand? So that way we can make sure that, because sometimes you look out and you see that it's the same set of people, the same small circle of people who keep winning these competitions, who keep getting the grants, who keep getting the funding to implement their solutions and all of those things. So let's have more of these people come into, and sometimes what they bring in can actually be the how do I put it, the tipping point that we actually make the solution very, 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 very inclusive and effective in those areas. So we can begin to look at ways of incentivizing their own involvement as well. And of course, not just in competitions and hackathons and in the hard tech work or in the domain knowledge aspect, but also in the idea generation and policy generation aspects of things as well as training, right? Training that community, one ethnic and I know quite enough of it. Have these in-house conversations, we have these in-house trainings where we sharpen down things that have to do with digital health, as well as engaging other people outside there on things that have to do with digital health and all. And this has gone a long way in sharpening my own digital literacy, digital health literacy generally as well. And so if we begin to take this down to the grassroots as well, right? Engage people. And I'm going to look that to my next point, which is like, you know what, we can actually make these digital solutions fit to use. A lot of times when we are talking about accessing digital health services and all, some of the examples that come to mind are web apps, things we can do on our Android phones and all of those things. However, tech is not limited to fancy devices and all of those things. And I think another thing that can help to encourage and include people, more people, especially in underserved communities like those in rural areas, in remote areas, people with low internet connectivity, using some of the things that they already know how to use. If you have a small phone that you can use a USSD code to send money, that you can use, you can press star something hash, and you can get your account balance, and you can get this and that. Then probably we can also begin to think about, I know a number of people are already doing that, but we can begin to think about expanding that access to that area so that they can access health information and services right from those kinds of phones as well. It requires low internet connectivity. It requires little to no technical know-how. Again, tying it into something they already know how to do, and then they're able to do that. So while we are still working on, general other systemic problems like poverty level, socioeconomic status, being able to afford these devices and all of those things, we don't have to wait. We can begin to look at ways in which we can leverage these existing things that they already do. It is also tech. It just might not be fancy the way we always, think what comes to mind first when we think of tech and all. Speaking of that as well, not everything is going to be fit for you. So again, as one of the panelists already said, if you make it context relevant, right? Make it context relevant to these people. And that way we are going to get more buy-in, right? And then we are going to get more people getting on board. And I think there are some things that when people start doing or start using them, and then the demand rises, it becomes a very, very obvious problem or a big elephant in the room that people can no longer avoid or push away anymore. So when we gather data from initial initiatives and programs and interventions like this, it can be kind of a proof that we can even take back to policy makers and policy implementers in government spaces and all of this is that see, young people really need this, minorities really need it, people in these rural areas really need this because we presented this to them in this form. They're already using it, they're seeing the benefits, and they could see more if you put these things in place, if you make this provision in their environment, if you build these cyber hubs or cyber spaces for them, if you give them these devices, if you do this, if you do that, if you implement this policy. And that way, we are going hand in hand and then we are working together to make things way better for everybody. Again, I think lastly also to make sure that these solutions are not too difficult for them to actually adopt, because no matter how great your solution is, no matter how great your idea is or whatever, if there's a lot of barriers to them being able to implement them, it's as good as nothing. Some of the people we've worked with are people that, maybe we are installing a system for them or a software for them, and they will tell you, this is not the first time we are doing this, but the last person came or the last company came, they gave us this software and it just duplicated our processes. It made it worse. So we are actually very, very, we are going back to our days of using paper. And so this is the last company we are trying, software we are trying before we give up and go back to that. So if we are going to make the solution very difficult for people, whether from the provider end or from the user end, and then you might as well, go back to the drawing board and fine tune it and make sure that this thing that we are doing is not going to just cut more people out and not even let them try at all and all.
Thank
I
you
think
so much, Esther.
thank you.
Thank you so much, Esther. That was really, really deep. And honestly, time really do fly when you have interesting conversation, because we can go on and on and on and on. There's so much solution to really talk about. There's so much problem to really identify, but we're a little bit out of time and we want to really take Q&A from participants as well. But before I take the Q&A session, I would like to ask a final question to Mr. Abubakari. And I know Esther spoke on multiple duplicity of silos, and I'm just wondering, how can we really synergize efforts into terms of looking at the policy? After policy, what next? After, what can we really do to make sure that these things are really implemented and all parties really do play their role into creating solutions and not multiple duplicity of silos that still perpetuate the same thing that we've been trying to avoid?
Thank you very much. The first point is we need to set up robust monitoring and evaluation systems. The monitoring and evaluation system must be well established, robust to monitor that investments in digital health, interventions in digital health are properly structured, tracked, and they are giving us the results we want. Just like we are all discussing, there is a huge disarray of investments across the continent. We as advocates, you and I, digital health, inclusivity, we will need to set up monitoring and evaluation systems that really would ensure that the investment we are putting together, we are trying to align it to priority areas. Like one panelist mentioned, there is the issue of duplication. If we have a coherent monitoring system, I believe we can avoid. Once we can monitor what every facet of the digital health system is doing, gender, diversity, inclusivity, the marginalized, once we know what we are providing to them, we can then look at how do we integrate these systems as a second step. First, we need to establish the baseline, monitor what are we doing at every stage. 2, can we integrate the systems? Then that brings us to the issue of integration. Once we think of how we can integrate it, then we deal with interoperability and standardization. How do we interoperate these systems so that they feed into each other, right from preventive, curative, to rehabilitative? How do they interoperate to give us a holistic healthcare solution from the digital perspective? Thank you.
Thank you so much, sir, for that really insightful discussion that you had. And honestly, looking at all of this framework could really, really drive the trajectory for Africa, especially because we're kind of unique and we have unique problems that sometimes do not really lend to outsiders' perspective. And that leads me to a Q&A session that asks the question of what is the value of international digital health integration? I think any of the panelists could answer that. Looking at this question, I think Dr. Dawes would be. Okay, please go ahead.
Yeah, I think what is really critical is not really about integrating. I think what's really critical is integrating data at different levels, at regional. Regional also as a continent as well in terms of data, so that we can benchmark in terms of better outcomes, uptake, inclusion, based on different metrics that are being designed. I think there's already a standard by the African Union. It's called FHIR standard for interoperability and data standardization that comes from the community level down to the national system to the African system. Again, still on paper, But I think it's a very good technical document that provides some guiding principles about how to do it. So we're going to see some data platform already doing that. But I think in terms of integration, I think what is key is that digital health innovations are fragmented and in silos. So the best way to do this is if, for example, there's no connectivity with the physical access point, the traditional healthcare facilities. So there should be a kind of a pathway for a patient that even though he visits the facility, he can continue care with a telecom, with a digital health provider, for example, remote monitoring or self-management. At the end of the day, so there's a continued journey, even though while he's at home. So there's a kind of combination of just not only creative health, but also the preventive aspect and also the lifestyle management. So there are a lot that can be gained. And I also believe it's a way of also reducing costs for the patient. Again, it's about how do we build a digital ecosystem that works in each country based on the available local solutions. I think what's more important is sharing of data. So I think I've tried to answer to some extent.
Yes, you really did justice to that answer. And I think the last question I also can take is directed to Dr. Dawit on how much ready is the Ministry of Health in Ethiopia supporting health workforce in digital health?
Thank you. So one of the priority by the government is to capacitize the health workforce on its digital health capacity. So as you all know, even though we have digital solutions at various health facilities, unless otherwise the health workforce is digitally capacitated, it's impossible to utilize digital solutions. So as part of this process, one of the things we have been doing is that we are working with academic institutions in Ethiopia. There is a specific program which is called Capacity Building and Mentorship Program, which is directly linking with universities. So that's when they are training their health professionals, they have to incorporate digital literacy in their academic curriculum. So that's one of the things we are doing with teaching institutions. So at the end of the day, when these health workforce are coming to the health sector, they are capable to utilize the digital solutions. They will be more sensitive to implement digital solutions. That's one thing. The second thing is on the workforce, which is already in the sector. So we have a specific department at the ministerial level, which is directly working on the health workforce development on their digital literacy. So we have a center of excellence at national levels, also at regional levels, which is continuously working on capacitating the digital skills of the health workforce. That's the other thing. And we have also institutional developing policy documents, which works down to facility level, which guides how they can capacitate their workforce. How can they mentor the health workforce while they are implementing digital solutions? These are some of the things we are working to really capacitate the health workforce in terms of digital capacity. Thank you.
Thank you so much. And I honestly think that this session has been so enriching and insightful. I've learned so much, and I'm sure our audience have learned as well. And it's really, really intriguing because this is different sectors talking and sharing their experiences. And honestly, there's so much work for us in Africa, especially considering everything that we have to do. But the beautiful part is there are a lot of solutions to really take from all of this conversation that we had. So I think we've come to the end of this webinar, and I'm sure it was very insightful as it was for me to everyone. Thank you so much. And at Digital Health Africa, one of the projects that we really want to undergo this time around is really looking at how African countries can really integrate gender diversity, inclusion, and accessibility into their framework. So we're open to partnerships and collaboration for different organizations into really achieving this goal. We've talked so much about how synergizing efforts is really the key thing. I want to say an amazing thank you to all our speakers. Thank you so much for honoring the invite and sharing all of this really insightful discussion that you've shared to us. I'll be handing over to Jide now. Jide, if you're still online, can you please wrap up?
I think you are muted.
Sorry, I didn't know I was muted. So thank you very much, everyone. Thank you, Taufika. Thank you, our panelists. Personally, I know what we went through to actually make this webinar come to fruition, from sending the messages. A lot of people postponed, and even the contractor of Farmer Access had to send Mr. Emeka. Mr. Emeka, thank you very much for coming on such short notice. Dr. Dawi, thank you very much. Dr. Body, thank you. I really enjoyed your insights into, especially from the minority groups and public health expert from Kenya. Thank you very much. I can't refer your name now. And everyone for attending, all the attendees, thank you for coming. We hope to hold this webinar, making a monthly thing, such that we have one webinar next month. And to keep updated with any of our information, you can follow us on our social media platforms, Digital Health Africa on Twitter, on LinkedIn, on Instagram. And if you have any question, or you have any information about partnership or collaboration, or you have any event that you think Digital Health Africa can be involved with, you can always reach us via our email and our social media accounts too. So thank you very much, everyone, for attending. It's been a really nice time, and it's been really nice and insightful time, and it's really learning time for all of us. So thank you very much.
Thank you for
Thank you
having us.
very much.
It was a nice session. Thank you.
Thank you.
Kudos, Digital Health Africa. Keep it up.
Thank you.